So today, we're not just looking at a surgical procedure. We're actually diving into a masterclass in strategic thinking, all centered around the SynCardia total artificial heart. And look, this is about playing chess, not checkers. It's where the very first move is designed to win the game, but much, much later. And this quote you're seeing, this is the central idea of this whole thing. It means that a successful transplant doesn't just start on the day of the transplant. No, it actually begins the moment that artificial heart is implanted. Every single decision, every stitch, is made with that final goal in mind, a successful, safe heart transplant down the road. It's not just about saving a life today, it's about securing a future one. So what is the SynCardia TAH? Well, it's what we call a bridge to transplantation. It is not a permanent fix. Think of it more as a life-saving, temporary support system. It completely takes over the job of a failing heart, and in doing so, it buys the patient the most critical resource of all, time. Time for a donor heart to become available. And you gotta understand, the patients who need this are in the most dire circumstances imaginable. We're talking about irreversible biventricular failure. What that means is that both of the heart's main pumping chambers, the ventricles, have completely failed. For these patients, this is the end of the line for other therapies, and it's the main reason a total artificial heart is even considered. So before a single incision is even made, the most important strategic move happens completely outside the operating room. It is all about patient selection. This, right here, is where the game is so often won or lost. So that's the crucial question, isn't it? How do you identify the right patient? It's a really complex decision, and it goes way beyond just looking at how sick they are. I mean, the clinical reasons are pretty much a list of worst-case scenarios. You've got cardiogenic shock, where the body just isn't getting enough blood, massive heart attacks that have destroyed the muscle, or even the failure of a previous heart transplant. These are patients who have very few, if any, other options left. But here's what's really fascinating. The patient's physiology, their medical condition, that's only part of the equation. The other part, which is just as critical, comes down to pure physics, the patient's actual anatomy. This number right here is a hard stop. For the standard 70 milliliter TAH, this is an absolute non-negotiable requirement. And this CT scan shows you exactly why. The device itself displaces about 400 milliliters. So surgeons measure the distance from the back of the sternum or breastbone to the front of the 10th vertebra. If that space isn't greater than 10 centimeters, the device simply will not fit. It would dangerously compress the lungs and other organs. It's a fundamental go or no-go decision. Okay, so let's move into the operating room and see how this foresight really plays out. From this point on, every single step is planned with one goal: to make that future transplant safer and faster. The first major step is called the ventriculectomy. That's the removal of the patient's own failing ventricles. But look closely here. This isn't a demolition. It's a precise dissection. The atria, the aorta, the pulmonary artery, all the key connection points are carefully preserved. The tissue planes are kept intact specifically to make it easier for the transplant team to get back in later. Next, these quick connects get sutured onto the remaining atrial cuffs. The best way to think of this is like building a docking station. This is where the artificial ventricles are going to click right into place. The sewing has to be perfect, not just for it to work now, but to provide a solid foundation for later. Here, you can see the left ventricle getting attached. And notice, even the placement of the external drive lines is a strategic choice. They're tunneled as far over to the side as possible. Why? To keep them out of the way of the midline for the future sternotomy when the transplant happens. Every little detail matters. All right, now we get to what is, for my money, the most elegant and critical piece of strategic foresight in the entire operation. It's a technique that's designed to proactively defeat the body's own powerful, but in this case, dangerous, healing response. See, as soon as the TAH is in place, the body does what it's programmed to do. It sees this huge foreign object, treats it like a major injury, and kicks off a massive inflammatory reaction. This is totally natural, but it creates a huge, huge problem for the next surgery. And that problem is called adhesions. This reaction creates thick, almost concrete-like scar tissue that fuses everything together: the device, the great vessels, the chest wall, all into one solid mass. Trying to dissect through that later is incredibly risky, with a huge chance of catastrophic bleeding. The key isn't to fix the problem later, it's to prevent it from ever happening at all. So here's the central problem for the surgeon. How do you stop this biological process that you know is going to happen and shield the patient's vital structures for the future? Well, the solution is just brilliant in its simplicity. They meticulously wrap everything, the device itself, the aorta, the pulmonary artery, you name it, in these thin sheets of Gore-Tex membrane. This acts as a physical barrier, an anti-adhesion shield. The scar tissue still forms, but it forms on the outside of the membrane, while the critical structures underneath stay pristine and free. Now let's fast forward. Months later, a donor heart finally becomes available, and now we see the real payoff. All of that meticulous planning is about to make a world of difference.
And the contrast is just staggering. Without the membranes, the transplant surgeon faces a long, dangerous dissection through that dense scar tissue with a high risk of bleeding before the transplant can even start. But with the membranes, they can enter the chest, peel away the Gore-Tex shield, and have the great vessels isolated and ready in under an hour. It transforms a high-risk ordeal into a controlled, efficient procedure.
This quote from the surgeons really says it all. What it means is they can get control of the situation quickly and safely, without having to resort to more complex, risky emergency measures. And that is the direct result of the foresight shown in that very first operation. So this brings us to a final thought. This procedure isn't just about medicine. It's a powerful lesson in problem solving. It teaches us that when you're facing a complex, multi-stage challenge, the best solution often lies in preparing for the final step right from the very beginning.